At the policy level and among professional organizations like NCCN, again, I think there's this hesitancy, this need to be educated, but there I think the biggest issue is they want to see the data, they want to see the evidence. And since these drugs are being approved by the FDA, sometimes that evidence is put in the public domain, it's put on the web. If there's an Oncology Drug Advisory Committee meeting, all that's transparent and available. But the more recent biosimilars have been approved without that public disclosure. There it's really critical that that industry, the companies, publish their data, their preclinical data and their clinical data in the peer-reviewed literature. We had one example recently, and that complicated our NCCN guideline update for the hematopoietic growth factors, where we neither had the public display of the evidence that the FDA reviewed or any peer-reviewed publication. So as a guideline panel, we could not really recommend the use of that agent. Eventually the company forwarded that information to us directly. But my point is, FDA approval is just the first step. Equally important is that the evidence that the FDA reviewed for approval of these agents has to be made available to the medical community, to the professional community, and to professional organizations like NCCN if they're going to be expected to endorse and recommend the use of these agents.